Hi, my name is Sarah Huber, and I'm an MD candidate in the IE School of Medicine class of 2022. The purpose of this presentation is to become familiar with the anatomy and some basic TTE views of a heart with normal function. TTE can be a useful tool in the assessment and diagnosis at the bedside for things like volume status, valvular dysfunction, ventricular failure, or cardiac tamponade, but the images can be a little disorienting when you first see them. It's important to review some basic anatomy first, including the fact that the right side of the heart is oriented more anteriorly in the chest than the left side of the heart. I think it's more helpful to actually view this image flipped, as this is similar to what you would see on the ultrasound screen. The anterior structures are closer to your ultrasound probe, which sits here on the chest wall. The other thing to keep in mind is that the tricuspid valve sits between the right atria and right ventricle, and the mitral valve sits between the left atria and left ventricle. The first view that's obtained is the parasternal long axis with the probe oriented with the dot towards the patient's right shoulder. Using the rule of thumb that the most anterior structure is going to be closest to your probe here, you know that the right ventricle is here, allowing you to identify the left ventricle and the interventricular septum here. You can see this structure filling the left ventricle, so you know this is the left atrium, and these leaflets here make up the mitral valve. You can then determine that this is the left ventricular outflow tract with the aortic valve sitting here. The next view you'll see is the parasternal short axis obtained by simply rotating your probe 90 degrees so that the indicator points to the patient left shoulder. The classic sign here you may see is the Mercedes-Benz sign identifying the aortic valve. The rest of the structures can be somewhat tricky, so keep in mind the rule that the most anterior structures of the heart are closest to your probe here, meaning that the right ventricle is going to be closest to the probe. You can then deduce that this is the right atrium and the tricuspid valve between the two. You know that the left atrium is adjacent to the right atrium, so you can identify that here. This does not show the left ventricle well. However, if you were to fan down the probe, you can identify this circular structure as the left ventricle, and this is the mitral valve leaflets closing here in the middle. The next view you'll see is the apical four-chamber with your probe here. The structures closest to it are going to be the ventricles. To identify this as the left ventricle, you know that your probe's indicator, which is screen right, is actually towards the patient's left side. If you can't remember that, then you can also look at things like the ventricle shape and the thickness of the walls. Knowing that you know that this is the right ventricle, then it's pretty easy to identify the left atrium, right atrium, mitral valve, and tricuspid valve. Moving your probe inferior to the xiphoid process and keeping your indicator dot towards the patient's left shoulder, you get the subcostal view. This first structure here is going to be the liver. And keeping in mind the rule that the right side of the heart is more anterior, meaning closer to your probe, which sits here, you can identify the right ventricle, right atrium, tricuspid valve between the two, and then you're able to see the left ventricle, left atrium, and mitral valve here. This view you can also sometimes see the IVC, but we don't see it in this echo here. If you get confused about the orientation, remember the right side of the heart is more anterior, which means it's going to be closer to your ultrasound probe. Thanks for your time today.